Hi, everyone, and welcome to Hi-Fi Health News. I'm Erica Grotto. Imagine this scenario. You take a vacation to Niagara Falls, New York. You're standing near the falls, admiring the view, when you start to feel sick. You call an ambulance, stay a few days in the hospital, and a few months later, you get a bill. Now imagine that same scenario playing out on the Canadian side of the falls. In Canada, there's a universal healthcare system funded by the federal government. It's confusingly called Medicare, but in Canada, Medicare is for everyone, regardless of age or income. What's it like to live under such a system? For answers, I turned to Dr. Christopher Labos, a cardiologist and epidemiologist based in Montreal.
So if you have an acute life-threatening emergency, you call an ambulance to go to a hospital, you are not going to get a bill after the fact. You will have to pay for your medication afterwards when you go for the pharmacy. And so when people talk about health insurance in Canada, it's often for prescription drug coverage more than anything else. A little bit for rehab, a little bit for sort of other related services, but by and large, what we're talking about is prescription drug plans. And if you're over the age of 65, you will probably be covered by the provincial drug plan, which is present in most of the provinces. So for acute care in Canada, I think it's going to be very different than the US, where you might end up with a hospital bill at the end, whereas here you will literally not have to pay anything.
For items not covered, like prescription drugs, as well as dentistry and eye care, Canadians often have health insurance, much like we do in the US.
When we talk about Canadians not needing private insurance, that's not technically true. A lot of us do need and have insurance, either through work or through marriage or what have you, for all the stuff that is not part of the medical system, which is eye care, dental care. And the reason why it was never incorporated into Medicare medical care is because when we go back historically to the inception of the Medicare system here in Canada, it began as hospital insurance.
But the difference in cost is the one Canadians find to be the most important when comparing the two systems.
I think there are a lot of complaints because people have seen a very noticeable difference between today and what the system was like even 5 years ago. And a lot of that is a question of access. They don't have a family doctor. As a general rule, I would say the vast majority of Canadians like the fact that we have a public healthcare system, like the fact that they're not going to spend $100,000 if they need heart surgery. And like the fact that they don't have to worry about being financially destroyed by a healthcare bill in the same way that, we hear some people are in the US.
That's it for us this week. I'm Erica Grotto with Hi-Fi Health News. Thanks for watching.